What is the physician's job? It is the physician's job to bring the body into a state of health. And if you don't have a working definition of what health means, then you can't very effectively get that job done, can you? If you'd like to have some fun, call up, just go to the Yellow Pages, go do an online search for MDs in your area, and randomly call an MD's office and say that you're a new patient, you just moved to this town, you're looking for doctors in your health insurance, providers network, and you need to have your doctor answer a couple of questions before you decide whether you want to get on board with them. Okay? Question number one, does this doctor regularly refer to chiropractors, acupuncturists, herbalists, or naturopathic physicians? Just see if they do. Now, in some states, naturopathic medicine is not licensed, so the answer should be no in those states. But in other states, every state, chiropractic medicine is licensed. So if your MD doesn't regularly refer patients to chiropractors, then that will give you some sense of the amount of closed-mindedness that they have. Now, I'm talking about general family practitioners, right? Second question, could you please email me this doctor's definition of health? Or could you please put the doctor on the line? I just want to know how he defines health. I'd like to know what his working definition of health is. Thank you very much. And watch what happens. Even better, tell the people that you're calling that you're recording this information for your, for your archives, and because your memory's bad and you want to have a recording of this, and as long as they know beforehand that you're recording it, it's all legal schmeagle and everybody's happy. And then I want you to post the responses on Facebook. I do. That's what I would like you to do, because, it's all in the... So this is one way that you can kind of take a look behind the curtains of what's going on here. And I would be very surprised, quite frankly, I'd bet solid money on it, that the person that you called up would not be able to give you a sophisticated, elegant, easy, breezy, lemon squeezy definition of health. And if your medical practitioner cannot define health, then they do not know what it is. And if they do not know what it is, how can they possibly help you to achieve it? They can't. And this is the biggest delusion that people are under all around the world, that their MDs are trained in healthcare. They're not. Your MD, bless their hearts, are trained in disease management. They do not know how to provide health care, because if they were providing health care, our health would be getting better and better and better, but it's getting worse and worse and worse. Autism skyrocketing, Alzheimer's skyrocketing, arthritis skyrocketing, obesity skyrocketing, life expectancy declining, infertility skyrocketing. Everybody is sick all of the time. And the reason that everybody is sick all of the time is because the people that own the show, the people that own the monopoly on medicine in the free world, the MDs, do not know how to define health, nor are they trained in how to help you secure it. And this is the billion-pound gorilla in the middle of the world that nobody's talking about. Well, I'm going to be talking about this, God willing, in the Creek Don't Rise on the Alex Jones Show tomorrow. 1 p.m. Central Time is when I'm scheduled to appear as a guest with Alex. Sometimes he runs late with guests, right? So I suppose sometime between 1 and 1:15 p.m. tomorrow, the 18th day of July, which is a Thursday, that I'll be on Alex Jones, and you want to tune into that program because Alex Jones has a big listenership. Alex Jones has a big footprint, and a lot of people have heard about Alex Jones. Hardly anybody's heard about Dr. Glidden, but that's all going to change after tomorrow. So get your people to listen to the Alex Jones Show tomorrow, 1 o'clock Central Time. listen to my interview with him. You can also watch the live stream, because Alex, like myself, always video casts his radio shows. So this is an important thing to understand, folks. Nobody understands it, nobody gets it, and that's why everybody is sick, and that's why everybody is beneath the wheel of physical ailments. Because the medical professionals that we lean on to help us get healthy don't know how to do it. The medical professionals that we lean on to help us get healthy do not know how to help us get healthy. They know how to stitch a wound closed. They know how to surgically remove a diseased kidney without killing you. They know how to kill the bacteria that causes pneumonia and gonorrhea and syphilis. They know how to do that. But they have no earthly idea of what causes chronic diseases. They have no earthly idea what causes heartburn, migraine headaches, asthma, insomnia, arthritis, fibromyalgia, anxiety and panic attacks, post-traumatic syndrome. They have no idea what causes these things whatsoever. Nor is the pharmaceutical industry interested in understanding the causative nature of disease. Because if they understood the causative nature of disease, then they would eliminate the disease. And they would be out of a job. Do you get it? Do you get it? Your medical doctor doesn't even know how to cure heartburn. You know, I believe antacids and proton pump inhibitors are either the number 1 or the number 2 largest selling drug in the world. Largest selling drugs in the world. Why is that? Because if they were to come up with a formulary that cured heartburn, then it wouldn't be the largest selling drug in the world. Because if you're managing something, you need to take the drug for the rest of your life, and that's good for them, it's bad for you, and it's not just heartburn, it's everything. But nobody has lined it up for the general public like this. Nobody has. I'm doing it. Dr. Wallach's been doing it. I mean, it's really just common sense. You would not go to a chiropractor to have an infected kidney surgically removed from your body, right? You would not do that. They're doctors. They're licensed and regulated doctors, but that's not their thing. Well, neither should you bring your body to an MD. If you're suffering with a chronic disease, you shouldn't do it, because the treatment of chronic disease is not their thing. They suck at it. They're bad at it. They're horrible at it. While we've let them treat chronic disease skyrockets. It's everywhere all of the freaking time, and because it's everywhere all of the freaking time, we have been deluded into thinking it's our fault. There must be some mysterious, genetic, complicated, sophisticated metabolic process that one day the researchers from Harvard University will get on the other side of. BS. The only reason that chronic disease is so out of control is because we've taken the wrong dog to the hunt. It's kind of like the MDs are a football team that only has a running game. That's all they've got. They've just got a running game. They've never heard of the pass. They don't know how to pass. They've got a quarterback who can't throw the ball and nobody on the team that can catch a pass. They don't have any running patterns. They don't have any passing patterns. All they do is run the ball, run the ball, run the ball. Well, if a football team just ran the ball, where do you think they'd end up at the end of the year in the NFL? Dead last. That's why your MD's therapeutics in the United States are the leading cause of death and the leading cause of bankruptcy, because they're a one-trick pony. And because they monopolize the medical theater, and because everybody is sick, and because we've been culturally conditioned to believe that they're the gods of medicine and can do no wrong, we just think it's got to be our fault. Can't be the doctor's fault. Can't be the doctor's methodology. It has to be something else, right? It's a sophisticated, complicated process. No, it's not. You've drunk the Kool-Aid. You're in the Matrix. You're down the rabbit hole. Pick your metaphor. You're wrong. You are suffering from the cultural delusion, the cognitive dissonance, which leads you to believe that the MD is the undisputed owner of the field of medicine and everybody else is a back-of-the-bus quack with substandard training. It's completely 100% incorrect. Your medical doctor is the last person to go to if you're suffering with a chronic disease. They are the last person you want to go to because they have nothing for you except man-made synthetic drugs sold to you at an enormous price, the intention of which is not to cure the problem but to suppress the symptom and manage the illness. And, you know, when you suppress symptoms and manage the illness, what happens? I told you about that last week. Another symptom develops because the body is a complex system of checks and balances, and a symptom is generated by the body only in the presence of a stress that the body has been unable to handle. The body experiences a stress, becomes destabilized, and punches out a symptom. Now the MDs suppress the symptom. The body falls further off balance and shoots out another symptom, and so we go until death do us part from the earthly plane of existence. It's a problem because it's everywhere all the time. And when I mean everywhere all the time, I mean everywhere all the time. Call your brother, call your mother, call your sister, call your preacher, call your next door neighbor, call your high school sweetheart. Call everybody that you've ever known in your life and ask them how their health is. Ask them how they're doing. Every freaking person on the planet is sick. Everybody is sick. And the only reason everybody is sick is because nobody knows how to procure health except us. We are the tip of the spear of science-based, clinically verified medical nutrition. And medical nutrition is where you need to be. Medical nutrition is what you need to understand if you are attempting to make your body healthy. Because medical nutrition supports and promotes your body's built-in God-given ability to optimize its structure and function. You can't have healthy bones without calcium, right? Well, where are you going to get your calcium? Where are you going to get the sulfur? Where are you going to get the 90 essential nutrients that your body needs? It's not in the food chain. Because it's not in the food that we eat, we suffer, go bankrupt, and then die. One more reason to fire your MD now. Yeah, I know. You don't want to work. Too bad. God works. We work. That's just the way that it is. But, you know, if you work, if you love your work, it's not really work, right? I mean, it's an old cliche, but it's true. If you love what you do, then it's not really work. It's just, you know, life. Life with zesto. Is that even a word? It is now. And so this is why I encourage everybody who's in the listening audience to consider the Youngevity business opportunity because it's awesome. From a pragmatic, economic, dollars and cents point of view, it's a really great business model. Hardly any startup costs. You completely regulate how long you work every day. You get built-in free support. It's great. And the potential is there. There are over 250 people alive right now who, with Youngevity, have made multiple millions of dollars. Multi-million-dollar earners with Youngevity. How did they do that? By helping their friends and family members, church members, and community members to enjoy a greater state of health. And, you know, that beats a poke in the eye with a sharp stick. Get with the person who told you about this radio show. Ask them to explain the Youngevity business opportunity to you. And if you came to us of your own volition, give us a call. If you're listening to this on a live radio feed somewhere in Texas or California, then give the radio station a call that you're listening on because they have people who can field your question and give you information about what we're up to. And we're a network. This is a good network, a group of individual business owners all around the world who have hitched their wagon to the Youngevity star and are moving forward, spreading Dr. Wallach's message of health recovery through science-based, clinically verified nutrition to as many people as will listen. Check it out. You know, it's a fool who makes a determination about something up or down before they know anything about it. So, and take me, for example. I had some built-in prejudice for 19 years against multi-level marketing. I don't want to do that. I'm a doctor. I didn't even know what it was, but I knew I didn't want to do it. 19 years. Then I finally sat down with Dr. Wallach about 5 years ago, had a heart-to-heart talk. He explained what it was. He explained how it worked. He explained what was required, and he explained what it did. And there was no looking back for me. And I have to tell you, I'm enjoying a greater revenue stream now than I've ever have in my life. I'm enjoying a greater revenue stream now than I ever did as a physician with a private practice. And I've been doing that for 22 years. I've been in private practice for 22 years. So I kick myself every now and then because I think to myself, oh, man, where would I, knowing how far I've come in 4.5 years, how much further would I be had I aligned myself with Dr. Wallach 19 years ago? I don't even want to think about that. Well, you know what they say, man plans and God laughs, right? So, and if ifs and buts were candy nuts, we'd all have a wonderful Christmas. If wishes were horses, beggars would ride, right? So, there's no looking back, but there is looking forward. I am encouraging you from the bottom of my heart with both feet planted firmly on the soil of economic soundness. Look at the longevity business opportunity. Give it a long look. And then see whether or not it's something you'd like to get involved with. Look, it's not for everybody. But having a judgment about it before you know anything about it is really kind of a silly thing to do. Been there, done that, and guilty as charged. Don't do what I did. Open your mind. Let people, somebody, longevity business owner, whoever told you about this radio show, let them explain to you what the business opportunity is, what's required, what you need to do, and then see if it's something you would like to do. And if it is, God love you, because, man, we need the help, right? I mean, honest to God, there was somebody at Starbucks right in front of you in line today. There was somebody at Timmy Hortons or right in back of you yesterday, somebody at the gas station, somebody at the grocery store, standing right next to you, who went to bed last night praying to God for help because the MDs have let everybody down when it comes to chronic illness. Everybody is sick and suffering. Everybody. So we have a task here. We have a pretty heavy responsibility, and we need your help in carrying the load. You don't even have to know how to spell vitamin to have a successful longevity business. All you have to do is tell the truth and point. That's it. It really is that easy. Get with the person that invited you to this program and have them introduce you to the longevity business opportunity. I'm telling you, there ain't going to be no looking back. Stick around, folks. Terry in Virginia is up next. Welcome back, ladies and gentlemen. You know who that is sneaking around? That's your pharmacist sneaking around. Actually, no, your pharmacist's a good guy. Pharmacists only know what they've been trained in. Actually, pharmacists know more about the drugs than your doctors do. And regretfully, when it comes to chronic disease, the MD profession has devolved into basically MDs are pharmacists who've been trained how to diagnose, and they do that poorly. Because all they do is deliver drugs. I mean, if you took away prednisone and pain meds from MDs, they wouldn't know what the heck to do. Because that's all they do all the time. Oh, anti-inflammatories, pain meds. Anti-inflammatories, pain meds, and the random antibiotic. Often prescribed for all the wrong reasons, which is why antibiotic-resistant bacteria are on the rise. It's not your fault. That's the MD's fault. Because of the willy-nilly, indiscriminate bad use of prescription medications, right? So remember, it's not the drug, it's how it's used. It's not the gun, it's how it's used. It's not the drug, it's how it's used. The gun is an inanimate object. The gun doesn't do anything, it's how it's used. Well, drugs, how they're used. The way that MDs use drugs? You kidding me? They're the leading cause of death in the United States. So yeah, let's go to those guys for health care. I don't think so. The medical system does not need to be upregulated, downregulated, managed, massaged, or tweaked. It needs to be abandoned because for chronic disease, it completely does not work, period. Let's go to Terry in Virginia and see what's cracking. Hey, Terry, thanks for the call. You are live.
Dr. Glidden.
Terry.
Hey, how you doing? Thank you for the Pink Panther music, and I really like the way you word things. You're a cool guy.
Yes, I am, Terry, and we're getting cooler every day, thanks to the efforts of people just like you. What's the latest on your condition?
I forgot to tell you about some symptoms I hadn't really been paying attention to since 2012 when my mother started getting real sick. But I was being treated for some low thyroid symptoms back around, started in 2009, and I was being treated off and on by a frugal naturopath, that me and my mother frequented. We had to drive 100 miles to see, out of the way, but anyway, she said that I had low thyroid, and I was listening to Dr. Tenpenny's lecture yesterday about iodine and selenium and low thyroid problems. Yeah. And I noticed that I've been having a bunch of the symptoms, such as hair loss, cold feet and hands, fatigue around 2 and 3 p.m., dry feet, cracked fingertips, dry mouth, brain fog, forgetfulness, slow metabolism. Yeah,
so all of these things are... So you're a candidate for, thyroid support for sure. So you want to become an insider, and you want to watch the webinar that I did on thyroid, because I did a 15-minute webinar that walks people right through what to do in order to give the thyroid a leg up. Now remember, we don't treat disease, we don't make any claims here, but it's common sense that the human body needs to have the proper nutrition. Your thyroid needs to have the proper nutrition. Your heart, your lungs, everything needs to have the proper nutrition. And it would be prudent for you to stop eating food that's coming up the works. It would be prudent for everybody to do that. And this is our recommendation across the board. So there's an essential oil called myrrh, M-Y-R-R-H, myrrh oil. Like frankincense and myrrh, right, from the New Testament. Myrrh oil, topically, on the thyroid area is beneficial for the thyroid. Iodized salt is mandatory. Selenium supplementation is mandatory. And also you need to visit a chiropractor and have them do an x-ray of your neck and make sure that the curve in your neck is correct. If the curve in your neck is not correct, your thyroid is not going to be correct no matter how much nutrition is in it. Went into more detail about that on my webinar, but I would check that out if I were you. So add some myrrh oil.
What about this thing Alex Jones is talking about and pharmacists being, was it nature's iodine or something like that?
Yeah, that's a good thing to do, but remember, iodine is one of the 90 essential nutrients. You don't just need iodine.
It. Oh, okay.
Yeah, you're already getting it. It's not a bad idea if you have a thyroid condition to take, or you think you have a thyroid condition, to take extra iodine. I mean, that's how we eliminated goiter. That's one of the good things the Food and Drug Administration did years ago. They noticed that in a particular part of the United States, there was an area called the goiter belt where there were hundreds of thousands of cases of enlarged thyroid. And it was pretty serious. And they figured out it was due to an iodine deficiency. So rather than doing 100,000 thyroid surgeries a year, they decided just to put iodine in the salt, and that's how iodized salt came into being. And when they just added iodine to the salt, the goiter went away. It went away. It went away. So, there's direct evidence that iodine is necessary for optimal thyroid function. So it's never a bad idea, if you think or you have a funky thyroid, to take extra iodine than what is in the 90 essential nutrients. So, but my recommendation is just iodized salt. But, what the heck? Give the nascent iodine a run for a month or two and see if it makes you feel better. Because there's nothing like the taste of the pudding, and the proof is in the eating, right?
Yeah. Now, would that have anything to do with the lumps in my breast?
Could.
Iodine problem.
Yes, it could. It's entirely possible that those two things are interrelated, but I'm telling you, you need to get that diagnosed so we're not guessing. Because if this is a big bad voodoo daddy, the sooner you know about it, the better your chances of survival are.
What about a thermography?
No, thermography isn't going to. Yeah, nope, it's not going to tell you whether it's a cancerous lesion or just a benign, fibrocystic nodule.
What about the Navarro urine test?
No, that's interesting. I'm not that familiar with it. I only have a tangential experience with that, so I can't speak to that. I don't know. If it were me.
I can't find a lady doctor who is into what, you recommended off of that site. There's none around except for one, and she's like 100 miles away, and then this other doctor.
Well, then you got to
does not take my insurance.
Yeah, so you got to fall back to Plan B. Then you just have to find somebody local who can do a biopsy, so you know. And I'm telling you, the sooner you know, the better, because you need to know what the hell it is.
I'm just scared of them.
Well, you should be more frightened of dying from breast cancer than you are of the biopsy. Let me tell you. You need to know what.
I'm scared of both.
Well, I would be too, but we have to kind of pick our battles here. I'm telling you, get the biopsy. That's my advice, because you need to know what you're dealing with, and that's the only way you can know.
I won't have the money till the 3rd. Is that soon enough?
Well, do that urine test in the meantime and see what happens. I mean, I don't have any experience with that, but, knowledge is power, and whatever you can do to dial this in as soon as possible is a good idea.
Yeah, well, it will be back by the 3rd,
Well, check it out.
And get the money.
Check it out and let me know what you find. I appreciate your phone call, Terry. Have to move on from Virginia to Toronto. Oh, David called back about hyperbaric chambers. Hey, David, thanks for the phone call. You are live.
Hey, the other day you asked me to call you back about the hyperbolic chamber, but I wanted to ask another couple of questions.
Shoot. Yeah, go ahead.
I've got the, what is a more economical? I'm doing the healthy blood sugar pack.
Yeah.
I've called you before and told you it reduced my blood sugar, my A1C, from 10.1 in January to 6.1 at the end of April.
Now, just right there, David, that proves beyond a shadow of a doubt that type 2 diabetes is not genetic.
Oh, yeah.
Because if you can manipulate your blood sugar levels with a nutritional intervention or any type of intervention, then the disease is not genetic, right?
Matter of fact, I've just been in the hospital for 2 weeks, and they took me off of the sugar list, as a matter of fact. But anyway.
Yeah, that's awesome. That's really great news, man. Okay, go ahead. Continue. Didn't mean to interrupt.
I wanted to know, is there a more economical way to do the healthy blood sugar pack? And I've been doing the Ultimate Daily and the Selenium. Now, you suggested I go to 12 Ultimate Dailies to help the circulation in my legs and feet and so on. Now, is there a more economical way to get the 90 essentials and to...
Yes, there is. It's called the Ultimate Classic Pack. The Ultimate Classic Pack. So the recommendation for you would be one Ultimate Classic Pack. How much do you weigh?
Well, I'm just under 200. So.
All right, so you would do two Ultimate Classic Packs, 2 bottles of Sweeties, and 2 bottles of Ultimate Daily Capsules a day, a month.
And by the way, I know you told me before, but I do like that liquid OsteoFX better than the powdered stuff.
I know, right? I know. I don't like to say it out loud too much because Longevity gets mad, but I don't care. I like it better too.
Well, it's better tasting, better texture, easier.
Yeah, and I think what we're finding from without even asking, just people are calling in and telling us that they have a better experience with the liquid than they do with the powder. Now, that's not everybody. There are some people that absolutely love the powder and they have a good experience from it, but I've never known anybody to have a bad experience from the liquid as far as, clinical results go. Yeah, I'm with you 100%. Now,
right now I'm doing two heaping containers in the morning of the powder, and then at night I do liquid capsules.
Yeah. So if you switch it up from the Healthy Start pack to the Ultimate Classic pack, then that would be a much more economical way. You may need to add one bottle of liquid calcium to that program. So it would be 2 Ultimate Classic packs, 1 Beyond Osteo FX liquid calcium, and 2 Sweeties and 2 Ultimate Daily Capsules. Now, because of your leg condition with lack of circulation to your legs, right?
Yeah.
A hyperbaric chamber for you would be a good thing to do, especially with the medical nutrition that you have. Now, the hyperbaric chamber, for those in the listening audience, it's the same thing that they put divers in who have the bends, right? It's a little chamber that you get inside of, and they pump it filled with oxygen, and they increase the pressure of oxygen inside, so it's forcing oxygen through the skin into your circulation. And for people with circulation issues like you, this is a really good adjunctive therapy to do for a couple of months to give your body a leg up, pun intended, on circulation from the outside, while you're helping to support healthy circulation from the inside, which is always a process, never an event. So that'd be a good thing for you to check out, David. Give it a run for its money, and let me know what your experience is. I appreciate your support. Welcome back, ladies and gentlemen. Where does the time go? We're winding down the first hour already. I know. What's up with that? Let's go to California and talk to Gary. Hey, Gary, thanks for the call back. You are live.
Thanks, Dr. Glidden. Diane and I talked yesterday about her brain situation with her daughter, and she had a couple of situations that she thought she should have mentioned to you. So, Diane, go ahead.
Hi, I was calling back again because I had told you that she had preeclampsia, high blood pressure, and all that stuff, but she has no signs of that anymore. She's not on any type of medication. The only thing she's taking right now is the heparin shots because she's immobile. So I had heard something about a product you guys have about putting oxygen back into the body. Is that something she could use?
Well,
she has an anoxic brain injury.
Yeah, no, I understand that. Anoxic brain injuries are caused by circulation issues. They're caused by circulation issues. Circulation issues are caused by nutrient deficiencies. So putting more oxygen into her body is kind of like painting over the mold on the wall. You know, you're not going to smell the mold anymore. You're not going to see the mold anymore. And for a while, things are going to get better, but it doesn't get to the root cause of the problem. So it would not be the first thing that I would think about. And the fact that historically she had eclampsia, you know, because you can't get eclampsia unless you're pregnant. You can't get that. I mean, that condition is only present in, women who are with child. But it uncovers, the eclamptic condition during pregnancy uncovers a greater nutrient deficiency, which until that time had remained hidden, which is not enough calcium. So if she had not enough calcium during pregnancy, she still has not enough calcium. It's just harder to see, right? So in any event, the recommendation stands that I gave yesterday. You can give her the Oxy body drops if you want to. There's no harm and no foul there. But I would follow my advice, to the letter yesterday, and I think that that's going to be sufficient to the cause. We've seen a number of people, come out of a coma on medical nutrition, and it can't be placebo, right? I mean, it can't be placebo. They're in a coma. So I think you're gonna have a very positive experience of her health once her body gets all of the raw materials it needs to optimize its structure and function. So keep your fingers crossed and call us back, why don't you, with a report. I certainly would look forward to that.
Okay, great. Thank you so much.
All right, you're welcome. Thanks, Gary. Yeah, you call me anytime, Gary. I appreciate what you're doing. New Mexico's up next. Kathy has a question, I think, about sarcoidosis. Hey, Kathy, thanks for the call. You are live.
Hi, Dr. G. It was good to see you in Anaheim.
Yeah, I know, right? How are you?
Yeah, that was great. I'm doing well. I've got a friend, though, that's very ill. I'm going to be seeing her this weekend, try to get her on the product. Best guess from the doctors, sarcoidosis, fibromyalgia, and was just in the hospital for 10 days with cellulitis and on an antibiotic IV and 15 different drugs, which I can't even remember them all.
I mean, so don't you just love that? Yeah, you pay medical insurance premiums your entire life. Mm-hmm. So hoping against hope you don't get sick. But, you know, it's your insurance policy, literally, for when you do get sick. And so you finally get sick, and you go to the people that you've been paying your whole life to gain access to, and they have no idea what it is. Isn't that just great?
Yeah, so I want to help her because they're killing her right now.
Well, you know, but it reveals a greater tragedy here, which is the incompetence of conventional medicine before the fact. I mean, they're incompetent. They don't know what causes it. They can't make a definitive diagnosis. She has strong and persistent symptoms that warrant hospitalization, and they have no idea what the hell's going on. I mean, you would not stand for that type of behavior in any other profession. We would not, but we give the MDs a pass. Oh, you know, whatever. I don't get why we do that. So the recommendation here is the Anti-Aging Healthy Start Pack Original Formula, 1 Anti-Aging Healthy Start Pack, 2 Selenium, and 2 Liquid Glucogel Plus, and 1 Immortalium. 1 Anti-Aging Healthy Start Pack, 2 Selenium, 2 Liquid Glucogel Plus, and 1 Immortalium per 100 pounds of body weight per month. Eliminate the 10 bad foods and have an eye towards 100,000 antioxidant ORAC points a day go down the hatch. 100,000 ORAC points a day down the hatch. Ever take that out for a ride. She's going to love how she feels. Hour 2 coming up, folks. Stick around.